Hi everyone, my name is Kaylee.
My name is Gabby.
I'm Sophia.
My name's Rebecca.
Today our presentation is on the brain functions and aphasias.
So our table of contents for today, first we're going to take a look at the right brain, next the left brain, and then we'll move on to our aphasias, the Broca's aphasia first, and then the Wernicke's aphasia.
Here are a couple terms that are good to know throughout the presentation. We have contralateral connections, right controls left, left controls right. I'll dive a little bit deeper into that in a second. And then we have corpus callosum, which is a band of fibers that connects the right and left hemispheres of the brain. So to start with the right brain controls functions on the left side of the body. It has contributions to language, including pragmatic information. Pragmatic information includes jokes, sarcasm, figurative language, narratives, and indirect requests. The right brain has a critical early role in the acquisition of language as well. So to continue a little bit about the right brain and to dive deeper, I found a scholarly article called The Brain Basis of Language Processing from Structure to Function. So the goal of the present article is to describe structural and functional neural network underlying sentence comprehension and how this process evolves over time as a sentence is perceived. That is a quote directly from the article. This article stuck out to me because the author states different brain regions in the left and right hemisphere have been identified to support particular language functions. This relates directly to our presentation about the functions of the left and right hemispheres, and then to dive deeper into the functions of the right brain specifically, I found a quote that is very scientific. You can read it here if you would like.
So let's move on to the left side of the brain. The left side of the brain controls the functions on the right side of the body. It also interprets visuals from the right eye. The left side of the brain controls speech, language, and recognition of words, letters, and numbers, as well as thinking logically, critical thinking, and reasoning. According to an article called Left Brain versus Right Brain by Eagle Gamma, the left side of the brain often contains language processing regions such as Broca's area, which produces understandable sentences, as well as Wernicke's area, which understands speech, which you will learn a little bit more about later. To continue, here's a diagram on the left side of the brain, kind of showing which lobes have which controls over the brain. According to the same article from before, the left brain is more associated with positive emotions, while the right side of the brain is more associated with negative emotions. Any positive emotion gets more processed in the left side of the brain, and any negative gets processed more in the right side of the brain. Comparing the left versus the right side of the left brain processes new information into understanding of events, while the right brain accounts for social behaviors, what you're seeing versus what you're seeing other people feel.
So, getting into what an aphasia is, according to Johns Hopkins Medicine, aphasia is a language disorder caused by damage in a specific area of the brain that controls language expression and comprehension. So, aphasia usually occurs suddenly after a stroke or a head injury, or it can develop more slowly with the presence of a brain tumor or progressive neurological disease such as Alzheimer's. And as far as who can acquire aphasia, it's more common amongst middle-aged or older people, but anyone can acquire it, even young children. And it affects about 1 million people in the US. And there are two types of aphasia, fluent and non-fluent. The most common fluent aphasia is Wernicke's aphasia, and the most common non-fluent aphasia is Broca's aphasia, which we will be getting into. So Broca's aphasia is the most common non-fluent, meaning that the people that have Broca's usually speak in short phrases, but people can still understand what they're saying. So, for instance, someone with Broca's aphasia may say walk dog, which would translate to I will take the dog for a walk, or book to table, meaning there are two books on the table. And so the damage primarily affects the frontal lobe, which can lead to symptoms of right-sided weakness or paralysis of the arm or leg because the frontal lobe is important for motor movements. And so people with Broca's aphasia may understand speech and know what to say, but struggle with it. So they can still comprehend, but their speech may not be as fluent. And so they also have a loss of normal grammatical structure, meaning that they may omit small linking words, conjunctions, or use of prepositions.
All right, so now we're going to talk about Wernicke's aphasia. So Wernicke's area. What is Wernicke's area? According to article "What is Wernicke's area" by Cherry in 2022, Wernicke's area is the region of the brain that is important for language development. It is located in the temporal lobe on the left side of the brain. A neurologist named Carl Wernicke examined the brains of patients that were not able to comprehend language and saw lesions at the parietal, temporal, and occipital lobe intersection, and this is now known as Wernicke's area. The area plays an important role in speech comprehension. So, Wernicke's aphasia. Wernicke's aphasia is a language disorder that makes it difficult for individuals afflicted to understand words and communicate. It's also known as a sensory aphasia or fluent aphasia. Those with Wernicke's aphasia usually speak nonsense, though with the same pace and grammar, but it's still nonsense. Also, those that suffer can hear and see words, but they can't comprehend them, so it's difficult for them to write. And unlike Broca's aphasia, comprehension is hindered, but speech is normal. Treatments include treating the underlying conditions such as the head injury or the inflammation if they have it. Speech therapy is the number one treatment for aphasias. Some can fully recover from Wernicke's aphasia. Kids under the age of 8 are more likely to recover from an aphasia, and recovery usually occurs in 3 months, but an aphasia can take up to a year to correct, and some may never gain their normal speech ability back. And this is a video of someone who suffers from Wernicke's aphasia, and you can see that those Wernicke's aren't able to comprehend what is said to them, and when they speak, they can speak fluently, but it's nonsense and not on topic.
How are you?
I'm happy. Are you pretty? You look good.
What are you doing today?
We stayed with the water over here at the moment to talk with the people over them over there. They're diving for them at the moment. They'll save in the moment. He'll have water very soon for him.
So as you can see, he wasn't speaking on topic, and though he spoke fluently, it was kind of gibberish. And yeah, that's Wernicke's aphasia. We're excited.